We want to turn to today's Healthy Woman, which is help for a chronic and painful condition called bloating. Millions know the uncomfortable feeling, and this morning we're joined by Eva Bowen, a woman who had serious bloating, she says, for decades, and it was painful, and Dr. Leo Galland, a Harvard-educated doctor and alternative health expert who came up with a simple way to help her, and something you think afterwards, well, why didn't we all know about that, which is why we're so glad to have you here. Let me start with you, Eva. We're not talking about something that was just incidental here. We're talking about something that really changed the way you felt all day long.
Yes, absolutely.
You'd start out in the morning, you'd be fine, and then what?
Then I'd eat lunch, and I'd have to unzip my clothing, put a sweater over me. I would feel so uncomfortable and bloated.
And you said at some point you'd even feel you had trouble breathing. It was so painful.
Yes, because sometimes the bloatedness it moves upward, so I can't breathe.
And you tried things, you went to see people, couldn't figure out what it was?
No, could not. But it was just after I ate.
All right, Dr. Galland, let's say Eva walks in to see you, which she did, in fact. The first thing you're going to look for to rule out is what?
Well, I want to find out whether this is really related to meals. Does it go away in the morning? If she doesn't eat for a day, is it gone? If it's fluctuating like that, then I know that we're probably not dealing with a really serious cause of bloating.
Right, serious causes like a tumor or something.
Tumors, ovarian cancer, liver and kidney disease, which would cause a persistent bloating, not due to the buildup of gas, but generally fluid or tissue.
Okay, so if you don't have constant pain or severe pain or fever, then you start looking at something else, and we're going to put up a list of possibilities with fluctuating bloat. Bacterial parasitic infections, intestinal disorders, food allergies. But you're saying you think probably the predominant one is that carbo bloating. Now tell us what this is.
Well, with carbo bloating, when you eat carbohydrate-containing foods, there's a process that can be called fermentation that goes on in the intestine. The bacteria or the yeasts that live normally in the stomach overgrow. They live in the stomach and the small intestine. They begin fermenting the food that you eat, the carbohydrates.
And they're interacting, I think, with sugar, because I see the B and the S up there.
Sure. Well, just imagine what happens when you take like a yeast starter. You're going to bake some bread. You mix in sugar and some flour, and you get a rising. It's the same kind of thing happening in the intestine.
And this is about certain people's biology, right? Not everyone has it.
That's right. No, not everyone does. And it's influenced by the way in which the intestine moves, the motility, and by what's growing in the upper intestine.
So the foods that you should have a warning flag on if you're susceptible to this are what? Breads, I believe we have a list of those too, breads and starches, sweets, sweets?
Sweets, sure, sugar. Sugar in any form may aggravate it.
Dairy products and soda, and you're talking about carbonated.
Well, soda has two things. There's sugar in regular soda, and then the carbonated bubbles just make it worse.
And Eva, as soon as you started eliminating those things, did you notice a change?
I feel so much better.
Never happens if you're careful?
Well, if I fast, I'm never bloated. And the minute I eat, I get bloated. And when Dr. Galland gave me this diet, I feel much better.
And you said also, Dr. Galland, there are certain things you can eat that might even help if you're susceptible. And let's put a list of those up, too. Meat, fish, poultry, why would that help?
Well, it's not so much that it helps. You need food, right? You need to be able to eat. And so the foods that are less likely to cause symptoms if you have carbo bloating are fish and meat and poultry. You can usually tolerate eggs. Most vegetables are okay, especially the non-gassy vegetables, but that's a very individual thing. Eva, for example, has no problem with broccoli. And what I'd recommended to her, and I recommend this to people as a trial, let's see whether this works for you, because it'll tell me something about what's going on. Eat only those foods for a few days and see what happens to your symptoms.
And is this connected to acid reflux, or is it completely different?
It's a separate condition. You may have acid reflux that improves when you treat this condition, because acid reflux is another very common problem and is associated with disturbances in motility.
Which raises the question about over-the-counter medicines or prescription medicines. You're saying you don't really need them if you watch the diet?
Well, there are no really good medications for bloating to begin with. So diet is really the cornerstone of treatment.
All right, Dr. Galland, again, thanks, and good to have you here. And Eva, good to know that you're feeling better.
Thank
that
you.
You found an answer. A lot of people, as I say, didn't even know about it. If you want to know more, go to our website. We'll take a break. We'll be right back on this Oscar morning.